A central venous catheter is a soft, small, flexible tube, longer than a regular IV. It extends all the way up to a large vessel that's just inside the heart. The catheter may exit out of the arm, which is usually called a PICC line. It may exit out of your upper chest, neck, or upper back, and that's usually a tunneled line like a Broviac or an implanted portacath. Or it may exit out of your leg or upper thigh, which is normally a femoral line. What the catheter is used for is to give IV nutrition, IV medication, or IV fluids if your body cannot otherwise absorb those fluids or nutrients through your stomach and your intestines. If a catheter is cared for very carefully, the same catheter can actually stay in place for weeks to years as your child undergoes intestinal rehabilitation and helps to support their growth and their nutrition and their hydration. The most important thing to know if your child has a central venous catheter is that they can continue to do many of the same things that a child without a central venous catheter can do. They can go to school, play soccer, travel, ride a horse, climb a mountain. The list can go on and on. However, we know because the line does end inside the heart that we have to pay extra attention to keeping clean and consistent care at home. Before you go home with a central venous catheter, the home PN team will teach you everything that you need to know about caring for a central venous catheter, from good hand washing, what supplies you may need at home, how to set up a clean workspace, the day-to-day care and delivering IV nutrition through the catheter. All of these things will be taught to you before you go home. One of the biggest risks and most serious complications of having a central venous catheter is getting an infection inside the catheter itself. Because this can be so serious, it's important to be able to recognize the signs, which can be any fever 100.4 Fahrenheit or greater, and recognize that you need to seek immediate care at the hospital. Between the education and training provided by the home PN team and providing very consistent care at home, we can avoid many of these serious complications of having a central venous catheter, and importantly, have a really good quality of life with the central venous catheter.